Right. Good morning, everybody. Thank you so much for joining us today for our 5th Hood County Child Health Summit. If you haven't already, please be sure that you have signed in to the event. We'll continue to put the link in the chat box for you all, so you can do that at any time. Please be aware that this session will be recorded and made available through website and social media links to inform and educate the public on this topic. At the end of today's summit, we will have a facilitated discussion with our Center for Children's Health team. You will be invited to unmute yourself to ask questions, or you can type your question in the chat box. Keeping in mind that if you choose to participate in an identifiable way, you acknowledge that your image and/or name will be recorded and are authorizing the use of your information in the recording as described. You have no obligation to appear or speak in the recording, and you can turn off your video and participate under a different name if you wish to remain anonymous. The recording of today's summit is protected by copyright law and is not to be copied. If you feel comfortable doing so, please turn on your video at this time. Thank you to our elected officials for joining us today, including Dr. David Blocker. Are there any other elected officials here today? Do you want to indicate that you're here? Maybe raise a hand. Well, we are honored to have you all here with us today. For today's agenda, Dr. Becky Hale, the Director of Child Evaluation for the Center for Children's Health, will kick us off with the Cook Children's Commitment. Then Dr. David Blocker will provide our formal welcome. After that, we will hear about Cook Children's efforts to improve children's health in the region, and then we'll receive an overview of the Hood County for Healthy Children to learn how we're improving children's health locally. A highlight of the day will be learning about the results from our most recent Community Health Needs Assessment and how Hood County children are doing in the following topics: healthy lifestyles, mental health, and parenting support. After the data presentation, we will take a short break before the award presentation. After the presentation, there will be a 15-minute facilitated discussion, and then we will finish up the day with a call to action and closing remarks. With that, I'd like to introduce Dr. Becky Hale. Becky serves as Director of Child Health Evaluation in the Center for Children's Health. Her team oversees the research aspect of our Community Health Needs Assessment, evaluation efforts for the programs and coalitions led by the center, and various reporting endeavors to both internal and external audiences. Becky has worked for Cook Children's for a little over 10 years and recently completed her doctorate in education, with her research identifying the overlap of community-based strategies addressing tooth decay, obesity, and asthma among children and their families.
Thank you, Lauren. It's great to be with you all today. Do we mind moving forward just a couple of slides? Great. And one more, sorry about that. All right, well, we are so glad you guys are here. Cook Children's is committed to serving the children and families in our communities, and we're excited to bring you results from our most recent Community Health Needs Assessment today. This assessment is one of the many ways that we fulfill our system's promise, knowing that every child's life is sacred. It is the promise of Cook Children's to improve the health of every child in our region through the prevention and treatment of illness, disease, and injury. In light of today's event and our needs assessment, I would like to take a quick moment to thank the leadership of the Center for Children's Health, Chris Pettigo and Marilyn Napier. And I'd also like to recognize the work of the Child Health Evaluation team in overseeing the needs assessment research that we'll share with you today, as well as Courtney Bernard, Lauren Purvis, and Jamie Josephson in the planning and coordination of our summit today. And at this time, I'll turn it over to Jamie, who will continue with our agenda.
Thank you, Becky. Excuse me. I'm Jamie Josephson, Program Coordinator for the Hood County for Healthy Children Coalition. I am excited to introduce Dr. Blocker. He came to the summit in 2019 and has been involved in the coalition ever since. Dr. Blocker is an aerospace and preventative medicine board certified physician with over 25 years of experience in patient care and public health. As a flight surgeon in the U.S. Air Force for 21 years, he provided primary care, occupational and preventative medicine to military members, veterans and their families, and served as the public health authority to over a dozen military communities around the globe. Dr. Blocker is also the medical director of Lake Granbury Medical Center Wound Care Center, providing advanced wound care services in the local area for over 2 years. Dr. Blocker is the only physician in Hood County authorized to provide FAA medical exams to commercial and private pilots, performing those exams at Acton Medical Clinic, where he also provides primary care. Dr. Blocker, I'll turn it over to you.
Thank you very much, Jamie. I want to take a moment to welcome everyone here to the 5th Hood County Child Health Summit. And again, I just want to say it's such a wonderful blessing to be able to come together with folks and to spend time on preventive medicine, focusing on areas and ways that we can help to improve the health of our folks across Hood County. With over the last couple of years, we've had such a focus on COVID, and even though we've had such an incredible spike throughout the month of January, our numbers across the community and beyond are finally trended down. And so I'm praying, as you all are, that we'll be able to move more and more towards whatever this new normal is. But that being said, I'm very thankful that we've been able to leverage the technology to be able to come together in any forum, and particularly in the opportunity to focus on prevention. So this particular summit began back journey began back in 2009 when Cook Children's first had an assessment of children's health in Hood County. And from a public health standpoint, it's so important to start with baselining, to know where we are now, to be able to plan appropriately for where we're going. So the fact that Cook Children's has been working with Hood County and other surrounding counties at this level of focus since 2009, and then starting this Hood County for Healthy Children in 2011, over 10 years ago now, is fantastic. In my experience here locally, without any type of a funded local health department, we rely so incredibly heavily on participation from community partners, medical, county and city and local governments, and partners like Cook Children's and Lake Granbury and the various medical institutions around our area. So again, I'm incredibly thankful for this program and this process. And again, in light of this over the last 2-3 years, as we as a community have spent so much time focusing on dealing with the public health crisis or emergency and pandemic of COVID, I think it's brought more to the public's attention just how incredibly important prevention and the healthcare issues that happen, the social determinants that happen that relate to the health of our community that occur outside of direct medical care. Specifically with children's health, as we'll see in this upcoming comments in the forum, there continue to be issues with access to healthcare, with how do we help to improve the quality of our children's lives. And that's not just visits to doctors, but that's also schooling, that's good nutrition, that's education in so many ways. So I appreciate the fact that this summit doesn't just look at direct access to healthcare, but it looks at all these other determinants as well. Mental health, emotional health, the safety and home situation for our children, because again, that's a multi-generational thing. But it most directly affects the children who are growing up in our various environments across the community. And so any impact we have while folks are still young makes a huge benefit to us as a society and socially going forward. So again, I'm very thankful for everyone spending their time here. I want to take just a moment to particularly thank some of our participants from our other institutions that I think for the first time they may be participating. We have folks from University of North Texas. We have folks from Health Science Center. We have folks from UT Arlington. On the side of public health, I've seen here on this, as well as folks involved in public health from Tarleton. These are all incredible community partners like that that are joining in and supporting our folks here in Hood County, in addition to our immediately local folks. So I want to thank y'all so much for participating in the summit today. But again, finally, again, I'll keep my comments short. Is introductory because we want to get to the meat of this, but I really want to thank the coalition members who have continued to participate in regular meeting, coordination, and involvement in these activities that make up Hood County for Healthy Children. Thank you, Jamie, for your leadership and consistency in that throughout this. And special thanks to Charlotte Caro, who is currently our chair, Haven't had a chance to meet you all a few times before we went virtual. It's very good to see you here as well. And thank you for leading this team throughout this kind of unprecedented time. Thank you all for joining us. And so again, I'm going to be more of a silent partner throughout the rest of this. I'm in active clinical care today, but I, as always, remain available through email at dblocker@co.hood.tx.us is my county email. And again, that's out there everywhere, has been throughout the pandemic and beyond. So if anyone has any specific questions for me or follow-ups for me, even if I'm not online at the time it comes up, feel free to email or contact me later on. I'll be happy to help with any follow-up on those. That being said, I'm going to hand it back to you. Thank you very much.
Thank you, Dr. Blocker. And Becky will join us again to lead us into the data presentation.
Thank you. All right, well, as we begin the data presentation, I'd like to highlight first just what a collaborative process our assessment has been this time around. I'll share an overview of our assessment methodology for you all today, along with a few more specifics around our parent and community leader survey demographics. And then Blair Williams will present the results, our data results for Hood County. Next slide, please. Okay, I would like to pause and recognize our numerous supportive community and research partners. And I'd first like to begin by thanking you all. I know that many of you in Hood County help share information about the parent survey with families in your area, and many of you completed the community leader survey or participated in an interview. So thank you for the part that you played in this assessment and just your support in this endeavor. I'd also like to thank Linda Fulmer, our CHNA administrator, and a big thank you to our research vendors who helped us collect the data: ATC Institute, MHMR of Tarrant County, the UNT Health Science Center School of Public Health, and the Center for Transforming Lives. I'd also like to recognize the many internal departments within Cook Children's who have been very supportive of our community health needs assessment journey this time around. And for this assessment, we brought together an external advisory committee made up of community partners representing the 8 counties within our service area. These partners met July of 2020 through August of 2021, and they shared their time and insight with us, especially as we were finalizing our survey instruments. They also created awareness of the survey during data collection, and some provided leader interviews. We had representation from all 8 counties on this committee, and I realize these 2 ladies may not be in attendance today as they have both transitioned into the next exciting chapter of their lives, but I would like to pause and recognize Becky Malden, formerly of United Way of Hood County, and Betty White for their role on this committee as they represented Hood County. We greatly appreciate their involvement. We expanded our 2021 Community Health Needs Assessment methodology this time around. We conducted a household survey of parents and caregivers of children 0 to 17 from all 8 counties within our service area. And it's important to note that this parent caregiver survey really provides us with information from the parent's perspective, which is so valuable, very, very important. But we also know it's just one piece of the puzzle. And so for that reason, we also included some additional methods of data. We held face-to-face interviews with families experiencing homelessness or with an undocumented member. We held virtual focus groups with families to gain a deeper layer of understanding around the barriers to access to care, COVID-19, and prevention topics. We conducted a community leader survey and held interviews with more than 20 leaders for a more in-depth conversation around children's health issues in their particular county. And finally, we reviewed local, state, and national data to fill in any gaps, to look at trends or benchmarks, or just provide some additional insights. So at this time, I'd like to play a video for you all, which shares a little bit more about this methodology process.
Maintaining good health for North Texas families is not always easy. Many families face obstacles such as poverty, discrimination, quality education, housing, and unsafe environments. Addressing these hurdles requires a community-wide approach with a shared goal: healthy children. Everything we do at Cook Children stems from the promise we've made to our communities to improve the health of every child through the prevention and treatment of illness, disease, and injury. One way we keep this promise is through our Community Health Needs Assessment. Every 3 years through this assessment, we hear from parents and community leaders throughout North Texas. The valuable data revealed in this assessment becomes a shared rallying cry for community partners who collaborate with us to prevent illness and injury to children. The Center for Children's Health leads the Community Health Needs Assessment research and outreach services for Cook Children's. The center works to prevent injuries and illness and improves access to services for asthma, child abuse and neglect prevention, healthy lifestyles, injury prevention, mental health, oral health, and parenting support. A key element within our Community Health Needs Assessment is the Community-Wide Children's Health Assessment and Planning Survey. This is a household survey of parents and caregivers of children newborn to 17 to assess their perspective about children's health across our communities. The survey asks questions about how various health issues affect their children and how easy or difficult it is to obtain medical care. We want to know the parents' perspective on children's health. This survey, available in English and Spanish, is administered to parents and caregivers through mail, phone, and email. Because we care about the perspective of all parents within our region, we send the survey to a random sample of 25,000 households within our 8-county service area. We also intentionally survey families experiencing homelessness and families with at least one undocumented member. We're able to survey enough parents to have a high level of confidence in our survey results. Parents and caregivers in each county also participate in virtual focus groups to give us a deeper layer of data. These focus groups allow us to further learn about the unique challenges parents face with accessing medical care and social services within our communities. In addition to the parent and caregiver perspective, we survey and interview leaders throughout the community regarding their views on children's health. Additional children's health data from national, state, and local public health and academic sources supplement the findings from parent and community leader surveys. We bring all this data together to share with communities across our region. Together with community partners, we work through our various collaborations to determine the best avenues to address these complex issues. It takes all of us working together to clear a path to better health for all children in our communities.
All right. Well, as you can see, we collected quite a bit of information this time around, and we would love to share additional details of our methodology efforts for those who would like to know more. So for this reason, we've created 9 separate FAQ type documents that outlines additional details of how we conducted our research. And we'll place a link in the chat to our website where these documents can be downloaded. And then, of course, you may reach out to us at any time in the future. Also known as CHAPS. You may remember us calling it that also previously. And we've conducted this since 2009, but we knew that due to COVID-19, it was time to update some of our survey questions to better align with the national survey of children's health. And this really helps us compare our results to the national and state results. And Blair will provide some of that information for you today in her presentation. We not only better aligned our questions to the National Survey of Children's Health, but we expanded our survey from households with children 0 to 14, as we've done in the past, to 0 to 17 this time around. We really wanted to capture more information around the health needs of the teen population. Next slide, please. And then we also included 2 additional counties. So we're now serving that 8-county region. And because of these enhancements to our process this time around, it means that we just want to be mindful when we might be comparing data from different survey years. We can still do comparisons to previous survey years, but because of the additional data we've collected this time, especially around our focus groups and our interviews, we aren't necessarily focusing on comparisons to our previous CHAPS or survey years today, but you're again welcome to reach out if you have a specific request, and we're happy to take a look at that for you. We recognize that this work is complex and that we know progress is happening daily. Our parent caregiver survey methodology included oversampling in counties with lower populations and then weighting those results by zip code to ensure that geographic distribution of the survey sample was comparable to the actual distribution of the 8-county population. We completed our target of 156 surveys in Hood County. And having a representative sample allows us to say things like, for example, 69% of children ages 3 to 5 in Hood County are ready for school according to their caregiver, which is slightly lower than the national percentage of 75%. Next slide, please. And with our community leader survey, this survey is not representative of the 8-county region, but we did receive a very healthy sample size. We surveyed 306 community leaders across the 8 counties. Leaders selected one primary county in terms of answering the survey, and nearly 8% of respondents selected Hood as their primary county. We also asked what role they were involved in within the community, and they're allowed to select more than one role on this survey. The top 3 roles that we received were the categories of health professional, social services nonprofit, and educator school official. And Blair will share more about these results in her data presentation. Next slide, please. All right, well, at this time, I will turn it over to Blair, who will present the results, and then Lauren will provide a final wrap-up of our data presentation. Before she begins, I want to share just a little bit more with you about Blair Williams. Blair is a child health evaluation analyst at Cook Children's Center for Children's Health. For the past 15 years, her expertise and passion for public health has been focused on child and family health. And in previous roles, she served as a community health educator, advisor to healthcare and school administrators, developer of family-centered community wellness programs, and researcher for family wellness behavior. Blair brings her experience, enthusiasm, and love for data to our community health needs assessments, program evaluation, and reporting. She loves Cook Children's and community stakeholders, all of the community partners that we work with, so she can bring joy and improved health to every child in our region. Please take it away, Blair.
Thank you, Becky, and thank you for that introduction. And like Becky said, I love data, love capital letters, LOVE. And it is an honor to be able to share the key findings of our CHNA report with you, and hoping that this information helps you either validate what you're seeing in the community or quantify the number of children with health needs in Hood County, so that could be used if you're writing a grant or seeking additional funding or resources to support your work. So it is an honor again to be here. And if you can go to the next slide, we'll talk about our presentation. Perfect. Okay, so today the presentation will be Help for Children and Families. And that is an acronym, and I will give that acronym to you in just a minute. But if you can go to the next slide. Thank you. All right, so we're all here today because we have the same question, right? How do we help every child with their health needs? And in Hood County, there's over 12,000 children under the age of 18. So that's quite a bit of children, right? So how do we help all of those children? Next slide. Okay, so today we're going to look at some data that will help us do that. We have quite a bit of data, as Becky has outlined, in our 2021 CHNA. But the main thing that I want to express is that we didn't just rely on quantitative data. We also brought in qualitative data. So that's the focus group interviews with parents, and that's interviews with community leaders. So that really brought depth to what we saw on those parent surveys and community leader surveys. Our findings today will focus mainly on that survey of caregivers with children 0 to 17. And again, that is a representative sample. So we could say an estimated population of children in Hood County that have a specific health need based on that data. And then as I'm presenting that, I'll also supplement that with what we heard from our face-to-face survey with underserved caregivers. And those are caregivers who at the time were in a homeless shelter and had children, or they had at least one undocumented family member at the time of survey in their family. So we'll supplement our caregiver findings with that information. We'll also look at key findings from our survey of over 300 community leaders in our 8-county service area. We'll also pull some really great quotes from a community leaders and parents who participated in interviews and focus groups. And for our community leaders, those are drawn from our 8-county service area. We had over 25 community leaders give us their feedback. And we also, through UNT Health Science Center, collected the information from 6 focus groups and 1 interview with caregivers from across the 8-county service area. We want to thank all of the participants in those focus groups and interviews, especially during a pandemic. So thank you for all that support if you're a community leader and participated. Also, to respect the privacy of our participants, any identifying information, including the county of where they came from, has been removed for this presentation because we want to respect their privacy. And to tie that all together, there is some key information from our secondary data that we got in our CHNA to help support what we're finding and reporting here for you today. That's from our US Census data, National Survey of Children's Health, and various resources from the CDC. What I'm presenting today is very high level. It's designed in such a way so that you could quickly digest it and help have a great discussion at the end of this session. If you're a data nerd like me, I would highly encourage that you go to our data dashboard. It's a new feature this year, and you could interact with the data. You could look at it by county, race, ethnicity, age group, income level. It's a fantastic offering this time around. And also, there's so much more depth in our CHNA report. So when that is available, and if you're really curious about more technical aspects of our methodology or more of our findings and how this all connects, please refer back to that CHNA document. It'd be a very good resource for you, especially if you're trying to get data available for your needs in the community for grants and such. Next slide. All right, so in our 2021 CHNA, we identified the following community health needs. These are ongoing needs that we've identified in previous CHNA reports: oral health, mental health, healthy lifestyles, parenting and family support, injury prevention, asthma, overall health, and equitable access to care. Now, these are not separated and isolated health topics. They're all connected. And at the root of all of these topics and health needs is that concept of social determinants of health. And Dr. Blocker mentioned that in his address. So that is the basis of all of these. And these are key concepts that we're going to see in the rest of today's presentation. Next slide. So if you're not familiar with social determinants of health and what that means, it's a term that's used in public health, basically saying that where people live determines their health outcomes. And for children, where they live, learn, and play impacts their overall health. So with that in mind, we'll carry that through for the rest of today's presentation. Next slide. So I come back to this main question, why we're all here. How do we help every child with their child's needs or their health needs? Next slide. So here's our acronym. Ta-da, HELP acronym, okay? So we'll use this HELP acronym not only to organize all the key findings from our CHNA, but it will also help you with your discussion later on today. So to begin, we have the health category, and any data in this section will be supporting equitable access to care and basic needs. The next is environment. That's safety where children live, learn, and play. The next is learning. That's readiness and support for academic success. And last is parenting, and that's any data around parenting and family support. And we'll use that framework for today's presentation. And if you have any questions about it, we'll certainly be available. But we also use this acronym in our CHNA report. So you'll find more detailed information around these categories in each health topic of our CHNA report. Next slide. All right, so we're going to start first with the H part of our acronym, and that's health. That's equitable access to care and basic needs. So in this section, these are some of the metrics from our caregiver survey that will highlight and supplement with qualitative data findings. So we're looking at health and oral health status, if they received all of their needed care throughout the past year, well child preventive visits, preventive dental visits, family-centered care. And family-centered care would be defined in 5 different ways. Ultimately, did that provider spend enough time with the child? Did they value their family values and customs? Did they make that parent feel like a partner in their child's care? And some of those other metrics of interest. We'll also look at food security. And for the purpose of this presentation, it's defined as, could they always afford nutritious food? And then last, BMI for age. Next slide. Okay, so let's first start with health status. So in Hood County, according to the parents that completed our survey of children 0 to 17, 9 in 10 children in Hood County have excellent or very good health. Now, this is a 5-point scale, so parents could tell us if they had excellent, very good, good, fair, or poor health status. And this is a helpful question because it also aligns with a national survey of children's health. So we can look at the data at a national and US level and see, or excuse me, national and Texas level and see how Hood County compares. So 9 in 10 children have excellent or very good health in Hood County. And that is consistent with what we see at the national and state level before and during the pandemic. And when I mentioned before the pandemic, that's referring to 2019. And when I mentioned during the pandemic, that's in reference to 2020. That's the most current data available at the national and state level. Now, if we look at the needs and gaps with this metric, 1 in 10 children don't have excellent or very good health, according to their caregivers. And in Hood County, that's about 1,200 children. Now, if we look at that data a little bit more and find out, okay, what are those children's demographics? What's going on here? We see that that ideal health status, which is excellent, very good, is lowest in our 12 to 17 age group in Hood County. And in the 8-county area, so looking broadly, looking more at our 8-county population, we see that that ideal health status is lowest among our Hispanic and non-Hispanic Black children. And if we look at this in terms of age group, we see that the likelihood of receiving a well child visit is lower in our school age children, that's ages 6 to 17, as to compare to the younger children 0 to 5. Next slide. Okay, so here we're looking at oral health status of children in Hood County. Again, this is based on what parents have told us, and we're looking here at children ages 1 to 17 because they'll have teeth at that age, right? So we have 7 in 10 children have excellent or very good oral health according to their caregivers. And when we look at that compared to our local rate, which is our 8-county and Hood County, or excuse me, and national and state, we see that like our 8-county data, this rate is lower than what we're seeing at the national and state level before and during the pandemic. So there are several reasons that could might explain this. There's many variables that could be contributing to this. So let's look at what our data shows us. If we look at that 3 in 10 children, that's over an estimated 3,200 children in Hood County that don't have that ideal oral health status according to their caregivers. We also see that that status is lower in our school age children here at Hood County, 6 to 17. And we also had a question in the survey asking caregivers how many days of school their children missed due to various health concerns. And 10% of school-age children in Hood County have missed at least one day of school because they had dental pain in the past year. Now, if we look at some of the other preventative features of dental medicine or dental health, children 1 to 5 in Hood County, only a third of them received a recommendation to get preventive dental care from their dentist or healthcare provider. And 19% of children ages 1 to 17 did not receive preventive dental care in the past year. So here it's important that preventive care and receiving that preventive dental care is important to their overall dental health. Next slide. Perfect, thank you. So let's take another look at what's happening with access to care here. So if we look at access to care in Hood County, based on what caregivers told us, 1 in 4 children did not receive all needed care for their health, dental, or mental services in Hood County. That's an estimated 3,000 children. Now, we had a follow-up question on the survey where we asked parents, why? Why did that child not receive the needed care? And the top reason across not only Hood County, but 8 county was that the COVID pandemic impacted their access. You know, clinics were closed. They were afraid of being in contact with others. So those are all common concerns. But second to that, we also heard that insurance wasn't sufficient to cover the cost of their child's care and that the services weren't available in their child's area. And if we look at this, this rate, this 1 in 4 rate, and we compare it to what we see at the national and state level, this is much, much, much higher than what we've seen at the national and state level, even during the pandemic. And it's similar to what our local rate is too. So this is something that's happening across the 8 county service area as well. And if we explore this data a bit deeper, we see that 15% of children in Hood County did not receive all needed dental care in the past year. 8% did not receive all needed medical care in the past year. And we come back to this family-centered metric that 1 in 4 did not always receive family-centered care that was sensitive to their family values. And 1 in 10 did not have continuous insurance coverage in the past year. So although most children in Hood County are insured, there is a portion that is not continuously insured, meaning no gaps in coverage. And even if they were insured, we heard from these top reasons why that may not have been sufficient enough to cover the cost of care. Next slide. All right, so let's take a look at what our qualitative data findings are. And from what we heard from parents and community leaders across our 8 county service area, we heard the same thing, that access to care is limited for children who live in non-urban areas, if they have Medicaid, or if they have an undocumented family member. We heard from parents that were saying they have to drive 30, 40 minutes or more to be able to get to the provider for their children, and that's if they accept their insurance. We also heard that transportation could be a concern if they don't have reliable transportation, or if they don't even have a car, it makes it really difficult to get the care they need. We also heard from community leaders that if a child is in a family that has an undocumented family member, or if they're Spanish speaking, it makes it difficult for them to receive care that they need or services that they need. And some are concerned that seeking care may mean that they could be reported or deported to a government by a government agency. And for mental care, the concern that we heard across parents and community leaders is that they're not sure where to even start. And here is a quote from a parent saying, well, where do I go? You know, do I go to a guidance counselor at school? Do I see a psychiatrist, a doctor? And just that overwhelming of not knowing where to start may make them not even get the care that they need at all. And then the other common theme that we heard was that parents and students had to miss school or work in order to attain their medical care. And we even have a quote here from a parent saying that they received a comment when they were picking up their children to attend a doctor's appointment that they were missing so much school that even the front desk lady made a comment about how they've missed so much school for their appointments. Next slide. Now, if we look at what our community leaders told us on their survey, and again, this is over 300 community leaders from various backgrounds across our 8 county service area, we saw that over 60% of those leaders surveyed felt that poverty and affordable housing are serious problems for children in their community. So again, this is all of 8 county. This is not just Hood County. But the comments that we heard from our leaders to support this were that there is a very clear distinction between those that have and those that do not, those haves and have-nots. We also heard about concerns around housing and affordable housing, and that the wait list for low-income housing is too long, and that makes it difficult for families that would qualify to get the housing they need. And then others said that if they were middle income, the housing market's so competitive and that the prices are so unaffordable in some areas that what it might cause is that they're stuck and they may not have a place to be. So they're living in cars, motels, or sharing living spaces with multiple families. And then another community leader really connected all of this, that the importance of having housing and stable housing really helps the overall health of children in the community. Next slide. All right, so let's take a deeper look at our data by income. So we asked on our caregiver survey if the caregiver could provide their income. We had it in 8 categories, all the way from 0 up to 150 plus. And so if we look at this for the simplicity of our presentation here, if we look at it into 4 categories, we're below 50K, 50 to 100K, 100 to 150K, and 150K plus. So for here, let's just look at below 50K as an annual family income. In Hood County, on our sample size, over 1 in 4 children lived in households with an annual family income below 50,000. That's an estimated 3,000 children. If we look at what the trends are at the from US Census data, we see that the median household income with families with children in Hood County is 83,000. So we have quite a depth of information here around income. Now, when we look at the children in that below 50K category, we found some needs and gaps. They were less likely to have that ideal health status or oral health status. Again, that's excellent or very good. And they had the lowest likelihood to be able to afford nutritious foods. Next slide. Now, if we take this category and broaden it, and we're looking at children in households below 100K, that's 2 in 3 children in our sample size that live in those households in Hood County. And that's 8,000 children estimate. And the concern that we heard from community leaders is that the COVID pandemic was really disruptive to children, and particularly children that were still under 100K, especially if it's like a single parent household. It's difficult to afford all the basic needs. And the concern is that they're having to choose and prioritize where their child's health needs are met. So if we look at the needs and gaps associated with children in this, this income category, they're less likely to receive all needed medical, dental, and mental care. They were less likely to be able to afford nutritious foods or access to physical activity, meaning parks in the community, after school programs, things like that, where they could be physically active. And they were less likely to have that normal BMI for age. So if children, if we broke this into categories by their BMI, we saw that children who had the highest food insecurity in our data were also the children more likely to have obese or overweight BMI status. And it may tie back to that fact that access to affordable, nutritious food or physical activity is limited for children in these income categories. Next slide. So to kind of tie this all together, you know, we're looking not only at just low income, we're quantifying it here. So children in income categories below 50K and up to 100K may have limited access to preventive care, where they could receive really important education on their overall health and getting that dental care that they need. Any additional resources such as food or housing, or any kind of emotional support is an opportunity to receive those from a doctor. And again, that theme that parents have to choose, that's a common thing that we've heard throughout community leader interviews across our 8-county service area. Next slide. So to tie up this section, how do we help every child with their health needs? And here we focused on health. And from our findings here and what we also saw in best practices from secondary data, equitable access to preventive care through going to the doctor, having their well child visit, and also for their oral health, receiving prompt treatment when needed for their health, dental, and mental health, and then access to basic needs such as housing and food. And while I've communicated all the needs and some of the things that we've heard from community leaders and parents, I want to bring your attention to all the positive things I've heard as well. And for each category here in our health acronym, I heard so many great stories from community leaders about how the community saw these needs, especially during the pandemic, and really rose to the occasion and came together. And so this is a perfect example of that. The pandemic impacted basic needs and food. Our community really stepped up to the plate. Churches and programs helped young kids with food and adults who may have lost their jobs. I'm proud of our community, and the community really came together. So to recognize all the good that's happened in the community, this quote helps summarize the basic needs. Next slide. Okay, so we'll move into our next section of the HELP acronym, which is environment. And this is safety where children live, learn, and play. And here we'll look at metrics of, did the child have an ER visit due to an accidental injury, adverse childhood experiences, otherwise known as ACEs, and neighborhood and school safety. Next slide. To begin, we'll look at our metric around accidental injury in Hood County. On our caregiver survey, we asked caregivers to report if the child had received emergency care for an accidental injury. And if we look at those responses in Hood County, that's nearly 1 in 8 children. It's about 1,400 children. Now, this is a stat that reflects children who received emergency care and had an accidental injury. So there could have been more children that had an accidental injury, but this is just a report of those that had that injury and received that emergency care. And if we look at what's happening at the national and state level in terms of leading causes of unintentional injury death, we see that that varies by the child's age group. So for infants, it's suffocation due to unsafe sleep environments. For children 1 to 4, it's drowning. For children 5 to 17, that's motor vehicle traffic accidents. And for young children and teens, poisoning and firearm injuries. When we see all this, it really does connect with what we've heard in that health section and what we'll hear in our parenting and family support section. Our parents in the focus group said, man, this could have just happened in an instant. You just turn your back and this is when the injury can happen. And then our leaders expressed concern about making sure that children had car seats, that they were riding properly buckled every time they were in the car. Others around lake entry points or where there's water to make sure that there's life jackets available or that children have water safety or swim lessons. And then also thinking about the pandemic or for parents that have to work and leave their children home alone, that if there are children, especially watching younger siblings, that could present an opportunity for an accidental injury in the home. Next slide. And so now we'll look at home safety in Hood County. And for that, we use our metric around adverse childhood experiences. This aligns with a series of questions actually that are on the National Survey for Children's Health, where it asks caregivers a series of questions and they can say yes or no, this event happened in the child's life. An adverse childhood experience, if you're unfamiliar with that term, it's essentially something that could have happened to a child that was a source of emotional or physical trauma, and that could ultimately carry with them into their adulthood and impact their overall health or mental health. And so for this stat, if we're looking at a series of these ACEs, in Hood County, 1 in 5 children has 2 or more of these adverse childhood experiences. That's an estimated 2,400 children. And if you'd like to know what all those ACEs are, they're listed here below that stat. So ACEs in Hood County, the most common ACE for children was parent or guardian was divorced or separated, followed by a child living with anyone that was mentally ill, suicidal, or depressed, or anyone that had a problem with drugs or alcohol. Now I'll pause for a minute because those were the two ACEs that were of the highest concern to community leaders when we surveyed them. And again, those were common themes and concerns from community leaders when we interviewed them. Now, those are the top three in Hood County, and those will clearly connect as we think through not only access to care for their child's mental health, but also the parent's mental health, and also providing that parent and family support. Now, if we look at this trend compared to what we see at the national and state level, this rate in Hood County, and even what we see at the local level, they are higher than the US and state benchmarks available that were before and during the pandemic. And another concern and a common theme that we heard from community leaders were that the COVID-19 pandemic itself should be considered an ACE because it was so disruptive to everyone's access to food, housing, just a lot of stress in the home, and that could really cause the pandemic itself to be an ACE. Another leader tied this all together from their experience because if a child has ACEs, that could show up in a child's risk behaviors, if they're using substances like drugs or alcohol, if they're having mental health concerns like anxiety, depression, or it could even show up how they are in the classroom, because if they're acting up or showing any kinds of signs of irritability, that could be a signifier that there's an ACE present in this child, or that they have some mental health needs, which will connect to our learning section in just a bit. Next slide. So if we carry this concept of safety in that child's environment with looking at income levels, we see that in Hood County, children in households below that 50K mark have some needs and gaps that I'd like to share with you. Children in this category were 8 times more likely to have 2 or more ACEs compared to higher income children. They were less likely to feel safe in their neighborhood or school for school-age children, and they were less likely to receive care for an accidental injury. So they may have been injured, but did not receive care for it. And if we think through what community leaders were telling us on interviews, what we heard was that if housing was disrupted for children, that may have meant that they were sharing crowded housing, or they were living in cars, motels, which also pose a safety concern. But another concern is that if there are infants in shared housing or bedding, that might be a risk for sudden infant death. So if a baby is sleeping with others and not alone in its own crib, that could pose a risk and also impact infant mortality rates in the community. Next slide. Okay, so to sum up this environment section, how do we help every child have safety from harm? Again, from all of our key findings and best practices from secondary data, we see that equitable access to family-centered healthcare to provide emergency care when needed, or injury prevention resources. So car seats, life jackets, porta cribs for children or infants so that they have a safe sleep environment, and lock boxes for firearms or medication. Those are all ways that we could help prevent those injuries in the home. Access to safe, stable housing and food allows safety in the home environment, and also that parenting and family support. Again, another positive quote, we did highlight the needs here, but we heard a lot of great things from community leaders, is that during the pandemic, the community was engaged and really did a great job to combat food insecurity and rental assistance when needed. And that child advocacy centers or organizations like that was a common theme, expected that rise in volume and the higher needs of children around safety, and really responded to help children, especially with schools. Schools responded to that as well. So a lot of great things that we also heard, and that the community was really responding to these concerns in the community. Next slide. Next section of our HELP acronym is learning, and that's readiness and support for academic success. Here we'll look at school readiness. This is based on what caregivers told us for children ages 3 to 5 years old, developmental delay, learning disability, and mental health. Next slide. If we look at children ages 3 to 5 in Hood County, and what caregivers told us on the survey, nearly 70% are developmentally ready for school based on growth and skills. And this, again, this is caregiver perspective. So if we look at that population and estimate how many children this represents, that's 500 children who may not have school readiness, according to what we heard from caregivers. This is a question that's also asked on the National Survey of Children's Health, so we're able to see how Hood County, our 8-county service area, compares. And similar to what we're seeing at the 8-county level, the percentage of kids who are school ready is lower than what we're seeing at the national and state level. Now, this could be based on many things. It could be based on the pandemic, because one of the things that we heard is that parents were concerned that their younger children weren't around other kids their age, and so they weren't developing socially because they didn't have that opportunity for interaction. Or if they weren't around other children or in a structured learning environment, it may have been a missed opportunity to assess some of those developmental milestones that weren't being achieved. And other things where parents weren't even sure what they should be looking for or where to go if they had any concerns. So this was a common theme that we heard from our parents. Next slide. If we look at children now 3 to 17, so we're broadening our age here in Hood County, and this is based on what caregivers told us, that they were told their child has a developmental delay or learning disability from a healthcare provider or educator. 1 in 10 children has a developmental delay. That's an estimated 1,100 children. And 1 in 6 has a learning disability. That's 1,600 children. Again, these are based on what caregivers tell us and not verified through looking at medical records. These are questions that are also available on the National Survey for Children's Health. And we could see that both of these rates are higher than what we see at the national and state level from before the pandemic. Again, those concerns that if they weren't around kids their own age or in the classroom environment, it was hard to catch those developmental or learning disabilities. And others were, community leaders expressed a need for having those developmental assessments or developmental delay opportunities to be caught earlier on in that child's age. Those are all needs that would be associated here. Next slide. And if we look at learning for school age children, that's age 6 to 17, here we'll look at mental health. So we're looking at children ages 6 to 17 in Hood County, and we asked caregivers to report if their child had ever been diagnosed by a healthcare provider, anxiety, depression, ADD or ADHD, or behavioral or conduct disorder. These are the 4 most common diagnosed mental health conditions in the state and country, also locally. And so when we look at that stat, we looked at how many school-age children have at least one of these 4 diagnoses. And in Hood County and in our local 8-county area, it's the same stat. It's 1 in 3 school-age children have at least one of the most commonly diagnosed mental health conditions. Now, this is a stat based on what caregivers have told us that they were diagnosed. So there could be more children that have mental health diagnoses, but not have yet been diagnosed, have not yet received any kind of screening to know if they have one of these conditions. Again, if we look at what the national survey has available at the national and state level, we see that our local rate and Hood County rate is higher than what we're seeing at the national and state level. Other concerns that community leaders expressed were that children don't necessarily show depression or anxiety like adults do. And so they may be coming to class and acting out or having irritability or behavioral concerns. And that could be a sign that there's anxiety, depression, or something going on at home. And so training available to help school staff with that or to de-escalate would be helpful. Others said that the concern of social media and just being on social media all the time, bullying, cyberbullying, the pressure to conform and outperform your peers could be all concerns. And that ties back to healthy lifestyles in this community leader quote, because community leaders identified that if children were outside playing more, if there were more accessible outdoor activities where they could be active, that perhaps that would draw them away from the screens, not only be good for their mental health, but also their overall health, since they'd be more physically active. Next slide. So if we kind of sum up this learning section of the HELP acronym, we see that access and awareness of developmental screenings and behavioral health may be limited for some families. We saw that other factors such as the pandemic, undiagnosed mental health conditions, ACEs, social determinants of health, or caregivers concerned, because if they didn't want to report that their child had any concerns, that could be a way that they're not getting the care that they need. And it could also impact our prevalence estimates here. The pandemic itself was a huge test to mental health. And so many community leaders and organizations have responded because they've seen an increase in suicide rates with children. That's something we've seen here at Cook Children's, and launched the Joy campaign around to help support that. But community leaders were telling us that they've increased their resources on suicide prevention, access to food, like those basic needs that we talked about in our health section, and youth resiliency. Again, drawing that quote forward from our health section is that there are undocumented families that are concerned of getting help, and they may need some additional resources to help their child with their mental health or any learning or gaps that they have. Next slide. And so from our findings and best practices from what we saw in secondary data, the way we can help every child with their learning, not only in Hood County, but across the 8-county service area, is to provide equitable access to family-centered healthcare, such as developmental screenings or mental health services, access to food, housing, parenting and family support, and coping resources to help with resiliency and suicide prevention. To summarize what we heard from community leaders, again, another positive quote was that schools recognized all of these needs and were coming up with really out of the box creative ways to not only provide children food so that they could focus and do well in school, but also to help them with their learning disabilities or any mental health needs. So schools have responded in force and would obviously need additional support to continue that. Next slide. Okay, so the last section of our HELP acronym is P for parenting and family support. Here we'll look at 2 key metrics from our caregiver survey. That's caregivers coping with parenting demands and if the caregiver has a source of emotional support. Next slide. On the caregiver survey, we ask a question. How well are you coping with the everyday demands of parenthood? And they have a 4-point scale that they could choose. And here we're looking at those that picked very well, which is the ideal status. Across our Hood County area and our 8-county service area, we saw the same stat that 1 in 2 children has a caregiver who is not coping very well with parenting demands. That's an estimated number of 5,500 children in Hood County. If we look at this rate, because this question, again, it aligns with the national survey, so we could see how Hood County and our local rate compares to that national and state benchmark. We see that, similar to what we're seeing here at the 8-county, that the rate of caregivers coping very well is lower than the US and Texas benchmarks before and during the pandemic. But all rates, Hood County, local 8-county, US and Texas, all of those rates have been decreasing since 2015. So this is not specific to Hood County. That could tell us that parenting is becoming harder, or there's just a lot more stress on the plate, which makes it harder for parents to cope. But if we explore our data a little bit deeper, we see that this rate is the lowest for children ages 12 to 17. So caregivers of children 12 to 17 are less likely to report that they're coping very well. We also see that the lowest ratings are among caregivers who are separated, widowed, never married, or divorced. So if you're a single parent household, then it's harder to cope. And if we add the stressors of pandemic And if there's any kind of economic stressors or concern around food or housing, that could certainly add to this single caregiver's stress load. From our parents, we heard that single parents especially were exhausted just from trying to balance it all and still be attentive to what their children needed. And others from community leaders, common theme that we heard was that witnessing parents argue or stress over anything related to the COVID pandemic was a huge sense of concern for children. Next slide. This next stat, again, it was on our caregiver survey. We asked parents to tell us if they had a source of emotional support to help with their parenting. This is a question that's also available on the national survey, so we can compare. But when we ask this, 1 in 9 children has a caregiver who does not have a source of emotional support to help with parenting. That's an estimated 1,400 children. Now, if we look at the opposite of that, we see the parents that did have a source of support, we asked a follow-up question: where did they get that support from? And the most common sources we heard in Hood County were other family member or a close friend, a spouse or domestic partner, and place of worship or religious leader were the top 3. We also heard healthcare provider or peer support group as the others. So these are all listed here just as a reminder that these are protective factors in the community. And when these are available to parents and caregivers, they're able then to be able to cope better with their emotional or their parenting demands. And you've heard me use the term caregiver throughout this whole presentation. You're probably wondering what I mean by that. This is a survey that's meant for parents, but we recognize that parents aren't the only types of caregivers for children. So we've included, grandparents in the mix, aunts, uncles, adopted families, foster families. So when we use the term caregiver, it's more of a broad sense of who's taking care of the children. And what we heard from community leader interviews or from parent focus groups, from a parent in particular, emotional support, I don't really know. I don't think I'm getting any. I attend church group meetings where we get to release, talk about what's going on. But that's about the only support I have or the people that I can talk to. Parents also said that financial stress, emotional stress, that really adds to the weight of the parents' coping. And others from community leader interviews said that if they're fighting in front of the child, that could make the child feel like a burden to their parents. And we've seen some mental health concerns with children as young as 5, feeling like they're a burden to their parents because of COVID pandemic. And this all ties together with what we see with risk behavior for youths, substance abuse, not only for youth, but also for caregivers. Caregivers may be coping with substances just due to all the stress. And then also mental health, not only for child, but for the caregiver as well. Next slide. So if we sum up this parenting section and how it connects to all the others, access to care, basic needs, and emotional support may be limited for some families. And there's other factors that could really influence that: the pandemic, the mental health of the caregiver or child, adverse childhood experiences, social determinants of health, or a caregiver's concern of being reported deported could limit their access to some of the helpful resources. And what we heard from parents too, and this is helpful when we think about healthy lifestyles or any other outreach efforts, is that parents that are struggling with those basic needs may not be in the space where they can accept more information on healthy lifestyles, for example. So here's a parent quote saying that we can tell people all day long that they need to have their kids in these outdoor activities, but when they're working 2 jobs, they can't afford to take them to the park or afford those nutritious foods. And I think between the nutrition lacking and the activity lacking, that creates a big snowball effect, which ties back to that BMI for age stat that we saw in the health section for children under that 100,000 category. Next slide. So how do we help every child and their family through parenting and family support? Again, it's that awareness of parenting and family support resources, equitable access to healthy food and physical activity, not just for the child, but the whole family. There's significant research that shows that when children eat family meals with their family, that they exercise together, that they do better academically, and they're less likely to get involved in risk behaviors, and they're also more likely to have that normal BMI. We also found that equitable access to family-centered healthcare, their preventive care, again, that's an opportunity to talk to the child's caregivers around their health, developmental milestones, any mental health needs or learning needs that they have, also to help them with any kind of resources like food, housing, or home safety. And then again, another great community leader quote around all of the things that have been done in the community to help. You know, I've highlighted all the needs, but there are multiple, countless organizations across our 8-county service area and in Hood County that are pulling resources together. And in this quote, a community leader told me that organizations are pulling resources together, and it's such a positive and uplifting thing. It's really profound. We also learned so much about available resources while connecting families in need with specific resources. In other words, while they were hunting to find something very unique to a family, they learned and uncovered so much more that was in their community that would be helpful to others. So a lot of great things that have happened in response to the pandemic with everyone coming together and just recognizing all of those needs and resources. Next slide. So we come to the end of our HELP acronym here. And if you know me well, you know there's two things that there's three things. Let me correct myself. There's three things that I absolutely love. It's data, it's puns, and it's acronyms. So this HELP acronym, I hope that it helps you with your discussion later this afternoon. Think of all these connected health topics with them being commonly connected to that social determinants of health concept, and that those HELP acronym categories around equitable access to care and basic needs, safety where children live, learn, and play, readiness and support for academic success, and parenting and family support. I hope that the way that this is organized in a simple, with simple stats and simple stories really help connect all this for you. Also in your packet, you should have received FAQs that bring out additional information around these topics. There's also a really great handout in there that uses this HELP acronym with some community hotlines that could be helpful to you and your families in the community. And also a reminder to check out our dashboard, because again, this is high level, but there's so much more. And I wish I could share every little bit of it with you. But of course, we're limited on time today, so I can't share everything with you. But these are some really great resources that are available to you. So you can learn more about what's happening in Hood County children. And with that, I will transition to Lauren.
All right, thank you, Blair. We've been so excited to share this information with you all, so I hope you all have enjoyed it, and I hope that Blair's been able to give you guys some new or validating insights to think about. Like Blair said, later in this session, we'll have an interactive dialogue where we can discuss this data and how to help children and families in Hood County. But before we take a break, I want to just recap a few key points from Blair's presentation. So for children's health needs, they need preventative care for health education, community resources, and social support to support child health and well-being. For environmental needs, children need safe and stable and nurturing environments to reduce risk of physical or emotional harm. For learning needs, they need preventive care, developmental screenings, behavioral health, or social services to support academic success. And then for parenting needs, we need to help address social determinants of health, such as access to basic needs, healthcare or safety, with social and emotional support for families. So with that, I think we're a little ahead of schedule here, but we'll go ahead and take a 15-minute break, and we will all return at 10:30, if that's okay with the rest of my team, and we'll continue on with our summit. Thank you.
Okay, we're right at 10:30, so welcome back. Before I introduce our next speaker, we wanted to share another video. Earlier, we saw a video about why we conduct a community health needs assessment and the different methodologies used. Now we would like to present a second video on what we do with data, how important our community coalitions and partnerships are to the entire process.
How do you improve the health of 1.2 million children spread across 8 counties? Well, it takes a lot of planning, a lot of collaboration, and it takes a lot of support from people like you. Every 3 years, the Center for Children's Health pulls together important data from the public through the Cook Children's Community Health Needs Assessment. That information helps us to build strategies to meet our region's most pressing needs through our programs and through our coalitions and community partners. We then work diligently to track our success. Are we all moving the needle like we want? Are we making a difference? This work is bold and big. Change at the community level often takes decades to fully integrate, but progress is being made daily through all our dedicated partners working together. We report on our progress annually to the government, state and federal, as well as to Cook Children's leadership and other internal departments. We also celebrate this progress with our collaborative partners and build on the collective wisdom our shared experience provides. Although we've always used data to drive our work, our first formal community health needs assessment in 2009 and the assessments that have followed validate the work we do through our collaborations and programs. Data also guides us on how and where we do our outreach. It's data-driven decision-making so that everyone benefits. As we review the most recent assessment data to create strategies for the next 3 years, we take into consideration what has changed in the communities. Are there changes in available resources? Are there new methods to address the needs? We also rely on our partners who live and work in each community to provide helpful context on key people and organizations to work with, approaches that have been successful, and where there are gaps we might help bridge. A few examples of how we utilize our assessment data include: determine new ways to support equitable access to care for all children, expand parent support educational topics, develop a program to identify and remove asthma triggers in the home, strengthen oral health messaging for pregnant women, promote a healthy lifestyle curriculum, including gardening basics for children. We then recommend revised strategies to Cook Children's leadership. Once approved, we have a roadmap for the work we will lead or support in our communities over the next 3 years. Every year, we coordinate progress reports that outline the incredible work our programs and collaborations are doing to improve the health of the 1.2 million children in our region. Gathering this information from families, leaders, and partners is a fundamental element in our efforts to help each child reach their full potential. The overall process is definitely an investment, one that will serve our community well for decades to come. Thank you for the part you play in improving the lives of children and families. Visit our website to learn more.
And now Charla is going to share a little bit about the Hood Coalition. Charla began volunteering at Rancho Brazos Community Centers in 2011, and because of her passion for outreach, she became the executive director in 2013. She supervises both adult and youth community service projects throughout Rancho Brazos Community Centers and various community partners. She prides herself on being a community advocate for all of Hood County children and their families. She is a member of the Hood County Substance Abuse Council, serves as the current chair for the Hood County for Healthy Children Coalition, and is the facilitator for parent cafes. Charla has been married for 30 years and has 3 grown children and 5 precious grandchildren who are the light of her life. Charla, you want to take it over?
Good morning. Thanks, Jamie. Can you hear me all right? Very good. Good morning. My name is Charlotte Caro, and I'm the chair of the Hood County for Healthy Children Coalition. I'd like to take a moment to share some of the highlights of the work the coalition has done in recent years. In 2011, the Hood County for Healthy Children formed in response to the first CHAP survey results. In a nutshell, the coalition works to increase community awareness about child abuse prevention and to promote healthy family relationships. The main strategies we employ to carry out this vision are engaging Hood County community to improve children's health, increasing community awareness about good parenting and healthy children to support families and children, developing collaborations to support good parenting and healthy children, monitoring and supporting children's health issues and community initiatives to reinforce a safe, secure, and healthy community for children. One major focus of the coalition is to support positive parenting practices. The evidence shows reduce the risk of child abuse. We do this by bringing parent cafes to the parents of Hood County. Parent cafes are small, intimate settings where parents and caregivers have opportunity to discuss their families, discuss challenges of being a parent, share ideas, and learn proven techniques adapted from an evidence-based program. They are a community-based initiative. We collaborate with individual volunteers and community partners to offer the cafes. The coalition has equipped over 30 community volunteers with the tools needed to facilitate parent cafes using an evidence-based curriculum called the Community-Based Education to Nurturing Parenting Program. Last year, we were able to add 10 new parent cafe topics to our current offerings. The coalition collaborates with multiple community partners for hosting parent cafes. These partners provide the facility and parking, childcare when applicable, and assistance with marketing cafe sessions. Since the inception of parent cafes, the Hood County for Healthy Children Coalition has partnered with community to host over 100 parent cafes in person and virtual. That's amazing. To say that we've done 100 is phenomenal. Provide parent education and support to over 400 Hood County parents and caregivers. What an impact that is making. More than a third of our parents attend more than one parent cafe section. It is especially rewarding when they tell me how they utilized information from the previous lessons, knowing that they really took it to heart and are connecting with their children more as a result. Because of COVID-19, we pivoted our parent cafe program to continue reaching our parents. We held several virtual parent cafe events and one-on-one parent cafes outside while social distancing to ensure all parents continued to receive the support and the resources needed. Turning now to our efforts to engage the community and increase awareness about community resources for parenting. The coalition adopts a number of strategies. Since the coalition's inception, we have distributed over 25,000 parent support tools and educational resources. This includes education on positive discipline strategies, parenting self-care, other evidence-based information to promote parenting best practices. Coalition members who support our partner organizations and events throughout the year, such as Ruth's Place, Rancho Brazos Community Centers, Paluxy River Children's Advocacy Center, the Hood County YMCA, MHMR Help Me Grow North Texas, Toller ISD, United Way, Hood County Substance Abuse Council. April is a National Child Abuse Prevention Month, so our coalition makes a special effort to increase community awareness with the support of our members and partners. This year, the coalition is partnering with Child Advocacy Center to highlight the importance of child abuse and neglect prevention on the courthouse lawn by providing pinwheels. Other organizations involved in this effort include DFPS, CASA, and the Child Welfare Board. Judge Massengill will join us and read a proclamation acknowledging the importance of creating a community that keeps our kids safe and secure. Thanks to CASA and Child Advocacy Center for setting this process. And finally, the coalition celebrated its 10-year anniversary last year. This is a huge milestone and speaks to the dedication and commitment the Hood County community has to improve children's health. These accomplishments would not be possible without the wisdom, the resiliency, the support of the members, leadership, and partners of Hood County for Healthy Children. Please join me in thanking them for all that they have accomplished. We are grateful for all their work these individuals have done. Ever so often, we get the opportunity to recognize one of those members for their hard work and dedication to improving children's health. At this time, I'd like to turn it over to Courtney Bernard to do just that.
Absolutely. Thank you, Charla. And Cook Children's is so grateful to work collaboratively with all of you and our partners in Hood County to improve children's health, and we couldn't do it without you. And sometimes we like to thank some very special people who have made substantial contributions to our community health improvement efforts. And today we are presenting the Center for Children's Health Green Crystal Award to Mia Best at Rancho Brazos Community Center. This is an award that the center gives to our healthcare heroes who have performed outstanding work on behalf of the coalition in advancing the objectives of Healthy Children 2030. And the Green Crystal is also given to folks who have helped our programming, in this case it's the parent cafes, to help move our programming forward or implementing them in ways that would not have been done without their leadership. So I want to tell you a little bit about why Mia Best was selected to be our Green Crystal recipient this year. Mia has been instrumental in providing support for the parent cafes at Ruth's Place, even through COVID-19. She did everything she could to keep her parents and kids engaged through pandemic, making sure they had continual access to support throughout. So you heard Charla talk about how the parent cafes pivoted. Well, Mia did this several times by switching to different virtual platforms, trying out Facebook Live and Zoom. She even did a drive-through parent cafe, outdoor settings with social distancing before they finally returned to in-person. So she was committed to making sure that happened. Mia also, she got her start as a parent cafe facilitator back in 2017 to learn more about the program, and then became officially trained in 2018. And since then, she has held 15 parent cafes. And then this most recent year, she attended our last training to help onboard new facilitators and to give a parent cafe testimonial about the impact that facilitators can have in the community. Now that Mia is working with Charla at Rancho Brazos Community Center, she is in charge of parent cafes not only there, but also assists with and mentors parent cafes at the YMCA and Ruth's Place. So this has allowed more families across the county to access this parent cafe program, along with building the capacity of other organizations and facilitators to serve more families. In addition to all of that, as if that wasn't enough, Mia is also bilingual in Spanish, so she is able to provide parent cafes to our Spanish-speaking families to make sure that they have the same access to support services. So adding on to a couple more words here about Mia's work in addition to parent cafes, she's been on the leadership team as an advisor for the Hood County for a Healthy Children Coalition since 2019, participating in work groups and providing extra support. She has been very involved in the strategic planning processes where her perspective helped ensure health equity for low income and our Spanish-speaking families here in Hood County. And Mia is committed, if you haven't figured this out already, but to serving the community. So in addition to the coalition and all those different ways, she has served on the Rancho Brazos board. She attends the Child Abuse Prevention Month meetings hosted by Biloxi Rivers Children's Advocacy Center. And she's also a key contributor to Operation School Supply, the back to school event hosted by United Way. So Mia's always finding ways to give back to the families of Hood County. And so for these reasons and many, many more, it gives us great honor to present the Green Crystal Award to Mia Best. And I'm going to pause because I'd like to see if Jamie Josephson, our coordinator, or Charla have a few words to also say about Mia.
Yes, Courtney, thank you. And I got the honor of dropping off the Green Crystal Award on Friday. So Mia does have it. That's a little picture that we took of her. And I just like to say Mia is always willing to go above and beyond to help her families that she supports. And as Courtney shared, Mia was one of the first to pivot to parent cafes to meet the needs of parents and families. And recently we started working on a video project to help promote parent cafes. And so I got the honor of assisting in interviewing one of Mia's parents that attended one of the parent cafes. And you could just see and hear the relationship that she has built with her families. And that is one of the things with parent cafes that make them so successful, is that relationship that you build with those parents. And so with that, Charla, is there anything that you would like to say?
I will just say that Mia is all heart. And when she came over to Rancho, it was a big jump for her, not professionally, but because of all those established relationships. And I am so in awe of the way that she has been able to maintain every relationship, every child. We saw it through Christmas this year. We see it through the week. Some of her children are even coming over here, or you see parents that are still getting that Mia love, is what I call it, because Mia has an innate ability to hone in a soft place or a weakness within a family and strengthen it. And I couldn't be more proud to be able to work with her. And I am so happy because she is so deserving of this award today.
Oh my goodness, thank you so much, ladies. Mia, you are clearly a very special person in many people's eyes. And we couldn't be happier to present you with this award. Would you like to share a few words with us today?
Sure. I guess I'm gonna start by saying thank you. That was all nice. It's always so weird to get any sort of recognition when you work in a nonprofit and outreach and ministry work, because we do what we do because we have a love for our community and want to help make it better for everybody, for those that are often underserved and forgotten, and for the kids that often fall through the cracks, as we just saw in some of that data, due to circumstances that aren't their fault. It's no secret that the last couple of years have been hard on us as a community, and we have all had to pivot and rethink and reschedule. So I think, Hood County as a whole deserves some recognition, because there's a lot of nonprofits that have worked together, in these efforts to reduce stress and child abuse and provide family support. But I knew
Thank
that
you.
Oh, sorry.
No, go ahead. I'm sorry I interrupted. Oh my goodness.
I knew with the amount of stress COVID was putting on families, we needed to offer as much help and support as we could to help reduce the amount of parental stress in homes. And Cooks was such an amazing support, and Jamie and Courtney and everybody's been so great in helping us provide all of these great tools and lots of information to our parents. And I knew that parent cafes were much needed during this time when we had all been separated and had lost our sense of community. So I tried to get the information out in classes going in any way I could. And I think the amazing thing about parent cafes is that they are flexible. It's not your typical parenting class. It's more of a parenting support group, and it gives parents tools and the ability to join in their own communities and build their own village, because it truly does take a village to raise children. And often we work with parents who believe they have no village. And a phrase that I hear and often say a lot working in outreach and ministries is, we are a hand up and not a handout. And while that is what we all are striving to do, I think a parent cafe is something a little more special than that. It isn't a hand up or a handout. Parent cafes are a helping hand through. They're a walk alongside and let's grow together to help all of our babies, because parenting isn't only stressful for low socioeconomic families, it's stressful for all of us. And I'm really excited to be here at Rancho Brazos Community Centers now, where we are branching out and doing more to help make an even larger impact. And Charlotte and I have really big plans, and I'm excited to get all of this out into the community. So I urge anybody interested in being a part of joining us and helping reduce child abuse in our community to reach out and learn more about becoming a parent cafe facilitator or joining the efforts of the Hood County for Healthy Children's Coalition, because I truly believe being a part of both is helping me make a true impact on the children and families in Hood County. That's all.
Thank you, Mia. Oh my goodness. And I hope you take a moment to look at the chat to see the congratulations coming from folks across the community for you. You managed to turn an award presentation recognizing you into something recognizing the community, and that just speaks to who you are. So, oh my goodness, we're grateful for you, Mia. And I have to say, you we did not plan it that way, but you just created the perfect segue for us into the next piece of our agenda today, and that is a facilitated discussion with everybody here on the call. So we have a couple questions we're going to pose. We definitely want to hear from you all, so please share in the chat and answer the polls as they show up on the screen. And I'll invite Blair, Jamie, and Lauren to also jump in to respond to those questions as well. So we'll get going with our first poll question. You can see some on the slide there. And based on what Blair shared in the data earlier today, what resources are available for families in Hood County related to parenting support? So maybe we can get the first poll showing up here. And while we get all of that situated, I'll say I love what Mia shared there. It's not a helping hand out or up, but a helping hand through. And that's perfectly related to this question here. What resources are in Hood County to help parents through their situations? And feel free to answer that in the chat. And there we go. Here's our poll. While everyone's answering the poll, I'll open it up to Lauren, Jamie, and Blair to comment. I love that we can kind of see the live results on our end, so we have a little bit of a sneak peek, but it sounds like Hood County, or looks like rather, is you all have a lot of resources available to families, and I think that speaks a lot to different protective factors that families need and that we can help provide through these resources. So that resilience component, or helping with relationships, or just increasing their knowledge on what's out there and what they need to help their child be successful, and just serving as that support network for children as well. I think Hood County is really great at doing that and finding ways to support parents, like everyone has been talking about, those parent cafes that are just so valuable to Hood County families.
Mm-hmm. And I'll just add, some of the resources, thinking through some of the resources that are available in Hood County. MHMR, Help Me Grow, and other programs that MHMR has is down in Hood County. We have Head Start. We have Rancho Brazos Community Center being a parent support, and Ruth's Place Outreach Center. Churches, of course, we saw this in the data as well, that one of the parents, I believe it was, they said that they turned to their church for support. And then, of course, YMCA. I know we often think of YMCA as somewhere to go get physical fitness, but I think that they are truly there for families as well. And then them just offering parent cafes is just another layer of them supporting families.
Mhm. I'm sure. Thank you, Jamie and Lauren. Hopefully the poll results are sharing on everyone's screen. That's the button I pushed. So for those of you who chose other, if you thought of another resource out there than the couple of answer choices we gave in the poll, we'd love to hear from you in the chat, or even if you want to share specifically when you selected parent networking opportunities and so forth, what organizations or resources came to mind for you. So feel free to put those in the chat. And one benefit of doing that is we'll be able to pull the chat after the event so that we can see everyone's answers and make sure that the coalition has that and we're touching base with everybody we need to be. While you all do that, you know, Jamie touched on this, but Blair, this was the whole P in the HELP acronym that this question addresses.
Yes. And, you know, I'm thinking about, you know, Jamie pointed out how churches and faith-based organizations are a source of support. From what I heard from community leaders during interviews, that they weren't just a source of support for emotional needs, but they also helped with various things like food drives, or helping families get connected with resources to help if they needed job or employment, or get them connected with rental assistance resources in the community. So faith-based organizations have been a protective asset. The other that's not listed here, and it might fit in that other category, is that if there were any after-school programs available to help, that would not only provide an opportunity for kids to sometimes get food, but it also help with parents if they're juggling work and life balance to have that additional, but also help them have more opportunity for physical activity in a safe environment. So those are other protective factors or community assets that could be helpful here.
Very nice. Okay. Here. Oops. Things are happening. Okay, hopefully I just launched the second poll here. Okay. Thank you guys. Okay, so our second question then is based on the children or families your organization serves, what types of community resources do families need the most? So for those of you in Hood County serving families, what do you hear from or see or are aware of that your families need the most? We're going to give everyone a chance to answer the poll as they come in. And like Lauren said, we've got a sneak peek of the poll results here behind the scenes, so they keep coming in. 82% so far and growing are sharing that access to basic needs like housing and food and utilities are one of the biggest resources we need. Wow. Okay, I'll go ahead and share the results here so we can see. Yeah, so we've got a majority of you saying access to those basic needs, and then looking at parent coping information and family resiliency. And then we can't forget about car seats and other safety measures. And again, if you selected other, we'd love to hear in the chat from you about what else you hear from the families that your group serves. But Blair, would you like to comment on how these responses match up with what you all found in the data?
Yes, thank you, Courtney. This might fit in the other category, but those two ACEs that were of top concern to community leaders on the survey, which were children living with anyone that has a mental illness or has a substance use disorder like alcohol or drugs, those were concerns to community leaders. So in addition to getting resources for children, if we want to help maintain that safe environment and mental health for children, resources available for parents to help with their own mental health and physical health needs would be helpful. Although no one has selected it, I don't think, for poison prevention medication lockboxes, I'd like to point out that the likelihood of families storing medication or firearms in their home is less in those lower income families. And it may be that they don't know that they need to lock it up, or they may not be able to get a lockbox. And so as it connects to mental health, we see the most common types of self-harm or suicide at the state and national level being medication or firearms for teenagers. So the importance of locking it up, not only to prevent accidental injury, but those intentional self-harm injuries is important. And as it pertains to firearms, in 2020 in Texas, the firearm sales nearly doubled. So that is a significant amount of firearms that are now in Texas homes. Most of those firearm owners, or those that purchased those firearms in 2020, were first-time gun owners who may not have lockboxes or know how to safely store them. So although it's not selected here, it does connect into making sure that that home environment is safe for children in the family. And of course, access to basic needs, that was something that was read loud and clear throughout the whole presentation. But also car seats, they may have them, but are they using them often? Are they using them correctly? And are they not expired? Those are all things to be aware of too, to make sure that they're always in the proper car seat whenever they're in the car.
Mm-hmm. Thank you, Blair. And in the chat, Elizabeth, thank you, added that another need she hears a lot of is after school and out of school care are high needs. So that's absolutely true. So thank you. I'll ask the group overall, and feel free, again, please put it in the chat, but in Hood County, are there opportunities for collaboration to provide or share these resources with families? We know the need is high. We know Hood County is rich in resources and people who care. So where are those opportunities to work together to make sure families don't fall through the cracks?
Courtney, I'll add on this just a little bit. Just some of the collaborations that we have already in the community include being involved in Hood County Substance Abuse Council and that cross collaboration. It is through Teresa with Hood County Substance Abuse Council that she offers parent cafes in Tolar ISD. And then with Comanche Peak for mental health, we're working together with them to get mental health information out there. And then, of course, just recently we had Safe Kids come and present at the coalition meeting where they did a big presentation on water safety, but they also presented on some of their other programs. So poison prevention, safe sleep, gun safety, and car seat safety.
That's great. So even the coalition is looking at so many different issues, even though the primary objective is parent support, but finding ways to support parents in all these other different ways too. I love that. Well, then I'll take us to our last question here. This is question number 3. There's no poll with this, but we'd love to hear from you all in the chat. What other organizations need to be at the table to improve children's health in Hood County? Heard a lot of groups mentioned so far. Oh my goodness, and Crystal just shared in the chat that United Way in Hood County has started a roundtable for nonprofits and other organizations to share. Crystal, do you mind unmuting and sharing a little more about that?
Sure. Sorry, I didn't mean to take over. No, we just decided that with our partner agencies and then those that aren't partner agencies just needed to get together. We get together once a month and kind of just want to make sure that we are covering the gaps. So we've got I mean, there's about 20 of us that come together and just see how we can help each other. I mean, I think that there are programs that, you know, Mia has started with the reading that the YMCA is looking at doing. You know, I think that collaborations like that have come together. So they're going to go and meet in one place. Anything that we can come together and do and share resources, just like the lock boxes with Hood County Substance Abuse or Child Abuse Prevention Month. I mean, we're just trying to get together and see what we can do to help each other out. So anybody's welcome. If you want to, just email me. I'll put my email and we'll add you to the group.
That's wonderful. Thank you, Crystal, for sharing that. There's one thing to know about Granbury and Hood County overall, not just the Granbury area, but Hood County overall, is that everyone here absolutely comes together to help each other out. And Crystal shared her email in the chat as well, so if you'd like to get in touch with her, thank you for that. Well, we'll see if there's, if you know of other organizations or groups, they don't even have to be their own organization, but other folks who need to be involved in conversations like this, please put those in the chat or share with us. We'd love to know that, and we can share that back out with the group as well, based on what you all recommend. But I want to thank all of you, Blair, Jamie, and Lauren, for adding your thoughts and comments as well. And again, if you have questions, please add them to the chat or reach out to us after the event, and we can get connected. So I'll pass it over to Lauren to wrap us up.
All right. Thank you, Courtney. Thank you all for sharing your thoughts and questions with us today, and thank you for spending your morning with us. Your support of the Center for Children's Health and the Hood County for Healthy Children play an important role in improving the health of Hood County children every day. And so, in the spirit of continuous improvement, we'd really appreciate if you guys could scan the QR code, or I believe there may be a link in the chat to take a very brief survey about today's event. Your feedback is taken seriously and will be used to help plan future events. And you can find more information related to the Center for Children's Health or how to get involved with the coalition and other resources on the Center for Children's Health webpage. Also, don't forget about the data dashboard that Blair shared about earlier during today's presentation. It's available to the public and contains really great information related to children's health in our region and Hood County. If you have any questions about today's presentation, please email chna-feedback@cookchildrens.org. And again, thank you all for spending your time with us today at our Hood County Child Health Summit. Have a great afternoon.